Okay, there's the current development and current government engagement in terms of the preparedness with the formulation and coming up with a response plan and also preparedness and response plan that should be able to cater for any eventuality of the Budubugyo virus disease within the country. So there had been discussions and full engagement of the government allocation to close to 2.6 billion, which is a substantial amount and shows the government commitment for the full support of the community, which is going to benefit in two ways. One, there's that availability of the essential commodities, drugs within the health facilities, so that we can have the continuity of health services at that level. And two, empowering the community members on how to pick signals that are, what I'll call congruent to the disease in question. So much of it is going actually to the community so that they can help them. And then apart from the continuity of services, there's a lot of issues and misinformation with regard to the disease itself, which I think we need just to mitigate and show the government commitment, especially on the level of preparedness within the country. There's well-organized, structured, response management, team that is in place, both at the national and also at the county level, in combating the same and in readiness for any case that might come in the country. We might be having deficit, but I think that goodwill of the government allocating purely money to mitigate the same, I think it's a good start. We look forward to not having the disease in the country because none has been reported so far, and as the government remains committed just to keep its population safe. Their risk, them being risk to the people that they come in from the cross border, from the countries in question. I think it is well, portrayed within the framework of the points of entry on how people should come in country. And I think there are protocols for that, how people should be made aware, how they should come and be screened if they are coming to those high-risk counties, as the country now remain vigilant.
So through the communities, through the community health promoters, the community health actors, the civil society organizations, we are able to detect threats to public health early, notify the health system where a response is done early, one, either to prevent an outbreak from happening, or where there is an outbreak, then to be able to contain it before it spreads further and even to the level of a pandemic. So the community health promoters are well trained. But we know beyond the training, they require to have the skills and the experience. And we also know that the community health promoters are also innovative in the way they perform their functions within the community. And hence this knowledge exchange forum. I'll give an example of the control of TB in the country. The community, once a case of TB is detected at the facility level, the community health promoters go to the community, to the households, to the social places to track and trace the contacts of this person who has been diagnosed with TB. They screen them for TB because it's the contacts that are the highest risk of getting TB. And once they screen them for TB, the ones who are found to have suspected to have TB, they go to the health facility, they are diagnosed, and those who are found to be TB positive are put on treatment early. One of the biggest achievements in the recent years that has been achieved in the TB field is that Kenya has been removed. Kenya for a long time was in the top 30, was amongst the 30 high burden countries for multi-drug resistant TB. And through the intervention of the community health promoters, Kenya is no longer one of the 30 countries with the highest burden of MDR TB. I'll give another example of even HIV. Kenya has achieved a high viral suppression rate amongst the HIV clients on treatment, again is through the efforts of the community health promoters being able to sustain the clients who are on treatment to remain on treatment even when they default.
I think community is our best line of defense, first line of defense in disease detection and response, because they are the people who are in the spaces where first cases are observed. And if we support them with the right knowledge and with the good understanding of the communication channels, they can offer very, very vital health intelligence that can help the authorities respond in time. And we know in pandemic response or epidemic response, the best opportunity to respond is immediately a new outbreak erupts. So, and a lot of diseases like Ebola start with very similar symptoms like flu or malaria or typhoid, generally febrile diseases. And if communities are knowledgeable and see a cluster of symptoms all of a sudden, either in children in school or within community settings, in marketplaces, they should be able to say that this is not normal and report as quickly as possible. If they're able to do that within 7 days, they will be able to have helped the health system to really respond efficiently and effectively. And therefore, we need to invest in them. We need to not use them as an add-on, but an integral part of a resilient health system, particularly in generating health intelligence. The consequence of failing to invest in these avenues is because it becomes very costly affair. Costly in terms of the lives lost, very disruptive because you end up with now things like lockdown, restricted movement, huge economic losses because a lot of countries cannot even travel now DRC to other countries because you have a disease. So it also takes us back a lot of times when you have to deal with that disease outbreak of pandemic potential. It requires a lot of resources, which will means we are now removing resources from other needs into this, and those sectors will suffer. We see that we saw that in COVID, and we're seeing it in other subsequent outbreaks. Yeah.